Hi, my name is Courtney Marsh, and the article that I will be discussing here is titled, Given Medicine, the Patients Got Better. They Remained in Shackles Anyway, written by Benedict, Carey, and published January 17th of this year in the health section of the New York Times. This article discusses the mistreatment of individuals in West Africa suffering from mental health disorders. These disorders include schizophrenia, hallucinations, and depression. The most common mistreatment included chaining the mentally ill to trees or concrete blocks and forcing them to pray and fast. A team of doctors from Ghana and American researchers teamed together to create the first controlled study providing pharmaceutical treatment to chained mentally ill individuals in West Africa. A group of 110 people suffering from mental illness consented themselves to participate in this study. Of these 110, half were diagnosed with Western labels and treated with antipsychotic medications. The other half had no change in treatment. According to Carey, after 6 weeks, those on drugs showed clear improvements on a standard rating scale that tracks feelings of hostility, emotional withdrawal, and hallucinations. While the outcome of the study showed the majority of patients had a decrease in psychotic episodes and presented clinical improvements, the number of days each person spent in chains was identical in both groups. Therefore, despite successful drug treatment and a decrease in day-to-day symptoms of hallucinations and delusional thinking, the length of time people were held in chains at camp was not reduced. The human right to prohibit the unlawful deprivation of liberty and the use of inhumane and degrading punishment is the bioethical dilemma demonstrated here. An additional ethical concern regarding this study is the obtainment of informed consent. Were these subjects in any shape to be consenting themselves? Unfortunately, the article does not address this dilemma, but it is certainly one to think about given our readings about the ethical responsibility of informed consent. The primary bioethical principles threatened here include non-maleficence and justice. Non-maleficence is the principle that obligates us to abstain from causing harm to others. This principle was clearly threatened in this current event article, given the continued shackle time despite improvements with medications. Justice is defined as fairness and appropriate treatment to individuals. The shackled mentally ill lacked justice as evidenced by their inability to break their chains to seek treatment. If the camp workers were to be viewed as the nurses, the code of ethics of nursing in this instance was violated. Respect of human dignity incorporates protection of human rights and caring of patients and research participants. The lack of information regarding ethical subject consent leads us to believe that research participants may not have been cared for. The camp workers also did not release patients from shackles despite improvement in symptoms violating the human rights of these research participants. Understanding the importance of respecting human rights and treating others how we want to be treated is the takeaway from this article. Although in the U.S. we have the luxury of mental health resources and laws preventing this mistreatment of the mentally ill, this article is an excellent reminder of the power of human kindness. The importance of continued research regarding treatment for mental illnesses is important for the future of healthcare across the world.